Good evening, ladies and gentlemen. Today, our group members and I will do our presentation about our study result and the case of use of SAP system in medical industrial. I will focus on the first question that how management team as a VLF done? Good enough or still need to improve? Uh, the answer we find out maybe is positive. With the helping of bringing the SAP system in, the VFF significantly improved their working pace ratio with performance by EFR and CPOE, reduced the possibility of wrong recording cause of misunderstanding because of the handwriting cost, and the prepare of the story will be much more safety and comprehend. Less error but reduce the workload of the staff. And the EMR system also bring more standardized operation process during the progress of treatment. Furthermore, the training of internal doctor could be more scientific and help them to shoot the arrow to the right target. All the points show the VOF really do a good job when they starting to use the SAP system. Thank you.
For medical records, before using SAP, doctors need to handwrite medical notes. It was difficult in identifying who wrote what in medical and clinical notes. When the hospital started using SAP, doctors type all medical notes into SAP. For medical orders, before using SAP, the doctor handwrote the orders. It was difficult understanding what was written in the medical orders. Orders could be given verbally. After using SAP, doctors must enter order in SAP. If they do not do so, supplies and medicines are not dispatched, and no procedures are performed. All information content in electronic medical orders is legible. Assistants do not comply with orders that are not in the system.
Okay, for drug administration, in the past, drug lorry alert were handwritten and attached to the patents chart. There was a risk they may not be seen. When started using SAP, the patent receives a bracelet with a barcode. When admitted into VLF, the nurse receive medical orders in SAP and papers. The drug procedures administrated. Drugs are charged to the patents bill, to inventory, and to accounts receivable. The most important thing about differently is accounting information required and interface to impact accounting control before SAP because of the SAP information entered online exported to major account.
Let's moving on to the next part. Could their change management strategy be used in another industry or hospital? As this new management strategy is cost-effective and time-saving, which would bring more profit to organizations, I think it can be used in big companies among all the industries. In the medical industry, for example, it could help doctors to examine the payment status of patients' invoices online, which means it would simplify the procedures. So doctors would handle more cases during the day, and the hospital could make more profit. As for other industries, let's take educational industry for example. It digitized student information and instructional resources. When most of the time is saved from taking one-to-one attendance in class or filling up the mark sheet after every exam, a lot of time is saved to be invested in what is more important, teaching code.
Have expanded their business scores through some changes in management strategy in order to gain more benefits. This management policy included developing some professional necessities and providing the youth service project. Although this management strategy can be better used in some large hospitals and industries, however, for some small hospitals and factors with single service and low volume of customers, it is not a wise method to improve their corporations because it could cause the enormous pressure in the operation of these organizations, and it also could result in the situation of supply exceeding the demand, which lead to a dramatically decline in the profit level. That's all the information of this presentation. Thank you.